If you go to the store, you would not know we're in the middle of a pandemic. Most people aren't wearing masks, and there are no mandates.
But according to doctors here in West Michigan, we are in the middle of a serious surge, the worst they have seen.
This graph put together by Spectrum Health shows the start of each wave and the decline. Now, last fall on day 100, that's when cases began to decline. Last spring on day 150, they started to decline. And right now we are at day 130 and they are still rising.
Health officials are calling the current spike a fourth surge, and there is worry that the rising number of cases will stretch our local hospitals even more.
Spectrum Health says they're at 85% capacity throughout the system. At Mercy, it is even worse.
Mercy Health Muskegon is at 101% capacity, and St. Mary's in Grand Rapids is at 99%.
We have big story coverage today, starting with Justin Bachman live at St. Mary's. And Justin, how is Mercy handling being so full?
Yeah, Juliet, really they're doing the best that they can, but this fourth surge is taking a massive toll, not just here at St. Mary's, but on the Mercy system as a whole. Some elective procedures already canceled through next week, and the wait times in the emergency room, well, those are going to get longer and longer as this surge continues. Now, according to Mercy's president and chief medical officer, this fourth wave is putting a huge strain on their ability in general to provide routine care. They had 51 inpatients yesterday. Today, that number is up to 64. He says about half of their beds are offline because they have to fill them with hospital patients. Regardless of the trends he's reading, he says that this doesn't look like it's going to change anytime soon. And possibly the biggest concern for Matt Bierzak, that president here at St. Mary's, is the fact that it isn't limited to just his hospital. He says the increase is impacting every hospital in downtown Grand Rapids and extending out to West Michigan as a whole. It's unlike anything he's ever seen.
We've had to, on a previous occasion, divert to Spectrum. More surgeries will get canceled. I mean, there's a lot of concern that this is the worst that we've actually ever seen, and that we're seeing numbers of patients that we've never cared for before.
Now, I asked Dr. Bierzak to clarify if he was talking about nothing he's seen before in the pandemic, and he says no, it's like nothing he's ever seen in all of the medicine he's been a part of for the years he's practiced. He says that hand washing, hand sanitization, masks, vaccinations are as important now as they were, if not more important, than the beginning of the pandemic. Nick?
All right, Justin Bachman at Grand Rapids, thank you. Spectrum Health also very concerned over its 7-day positivity rate, which is now nearly 23%, and that is the highest it has ever been, ever, in all of the pandemic. Currently, there are 367 people hospitalized across the entire health system. That's up from 232 last week. They say most of those being treated, 85%, not vaccinated. The numbers are closer to 95% unvaxxed for people in the ICU or on a ventilator. We asked officials about the possibility of opening up field hospitals, or what they call alternate care sites, as they fill to capacity.
We have conference space, we have shared workspaces that could be converted, that would provide the proximity to the services that our patients would need. The challenge of a field hospital is so often it's standalone.
Officials from the health system are continuing to urge vaccination is the best way to combat the rising numbers. The state's vaccination dashboard was last updated on Friday. The state is sitting just below 70% of eligible residents 5 and up having received at least one dose of a vaccine.